trust values and leadership behaviors guide what we do every single day. We run a clinical leadership development program to develop leadership skills amongst aspiring medical managers. If you walk around any of our sites, you'll witness our values on display in our colleagues every single day. Whoever you are and whatever your role is, we all understand why we're here and what our aims and objectives are. One of the reasons why I love working for NHFT is because of its values. For me as a clinician, I always strive to do the best for my patients. And when you work in an organization where that is embedded within the culture, it makes it very easy for you to achieve that.
To anyone new coming to join our team, I would say we are close, we are dependent on each other, we speak to each other, decisions are made collectively. It's very simple whenever you're faced with a choice, when you're part of the team. If it's in the patient's best interest, it'll be supported by everybody. And we have a culture where we believe that we have to look after our staff and our staff families so that they can look after the patients. One is not possible without the other, so we will do our best to look after you and your family when you join us.
I think I want to sort of be a role model for new doctors who are coming within the trust and tell them that there is an opportunity to grow.
The trust is quite open. There is psychological safety in the trust. That means as joining as a new physician, doctor, or clinician, we make sure that they be part of the team. There's a good induction for them to make them understand what their roles and responsibilities are. We also make sure that they have a mentor, and also we look at what are the possible developmental needs they have expressed. If we think that they've got talent and they want to progress into senior management roles, then we also encourage them through different programs and then ensure that they can meet those personal development needs.
I enjoy the people that I work with. I find the job is diverse, it's challenging, and there's a lot of support for me personally and professionally. And my managers always encourage me to find ways of growing my career and expanding my knowledge. You will get a robust induction. If you're moving newly into the town, they also provide support for doctors, especially those that are moving from abroad. There's a lot of support to help you settle into the town, accommodation, schools. You get a lot of all-round support to settle into the community. And like I said, work-wise, you're encouraged to grow your knowledge, your clinical knowledge and skills, and also to flourish. There are no glass ceilings. You can go as high as you want to, and you're pushed and challenged to do that. So I would encourage anyone to try NHFT.
We are a very well-oiled team, very coordinated team, and our driver is the clinical care, the patient, and the outcome. Most of our consultants today have been trainees with us, so they have chosen to stay with us. Itself speaks a lot about what we offer. What I would say to anyone wanting to join NHFT is don't have a second thought. Just come and join us. We are the team to beat.
We have fantastic colleagues, and there are people who are in various stages of the training, be it foundation doctors, then we have core trainees, we have specialist registrar in psychiatry, we have consultants who come in and apply, and also middle grade doctors, who are a group of doctors who are called specialty doctor or specialist doctors, and we also have international medical graduates. Our trust is one of the first where we have worked with the General Medical Council to improve recruitment for doctors and supporting them.
I enjoy that it is a relatively small trust, and that means that you really get to know your colleagues well. I think the trust works well on a mixture of a good mixture of informality and seriousness where it's appropriate, and I also value that my views are listened to and respected.
I actually joined this team as a new consultant, so I'd been a trainee elsewhere and I came to this trust, and I have to say that the support was amazing. I was supported from in terms of my senior colleagues, but also junior colleagues in the team. I've had a really smooth transition into consultant life, and I would say it's been extremely supportive. In terms of the specialist training for perinatal, for people who may not have perinatal experience, the Royal College of Psychiatrists offer perinatal masterclasses, both for trainees and also new consultants. And that is normally 10 days of specialist training to help people who become, perinatal psychiatrists. And that's been invaluable for me.
I think the reason I chose mental health to work in mental health was because I've always believed in the fact that having good mental health is the key to having a good quality of life. Because if you have a good mental health, I think you can enjoy, your life better. If you don't have your mental health together, then even if you do have the best of physical health or all the riches in your life, I think you don't enjoy your life. I think so to improve the quality of life of a person, it's important to have good mental health. And I think if we can contribute to that working in a mental health unit, it's just an achievement for us to see that we can improve somebody's life there. During this period where I have moved from my higher training to becoming a consultant, I have also made a good network of friends, which I really cherish. And I think that was another reason why I wanted to stay in NHFT as well, because I have a good support network now, I feel, because I've got to know how people work and I've made good relationships with them as well over a period of time.
If you're joining us as NHFT, we look at you as an individual, your individual needs, your expertise, and how you can help the patient. We then work around or work with you to develop that aspect. Following that one, if we think that you're going to be quite good in managerial aspects or if you have a talent, then we'll encourage you, see, why don't you look at a leadership training program? And then we have an in-house program, but we also encourage you to become part of the ICB, show your interest and make sure you develop pathways. So it's a good place to be because of the element of working together. And also, like any other trust, everything takes time, but if you're there driving it, we will be behind you supporting so that you can deliver the best care for the patient.
NHFT is a really great place to work. We care deeply about the people that work for us, and we do our best to make sure that they're all looked after, that they've got clear, achievable objectives, and that they're enjoying coming to work. We know that people are more productive when they're happy, and when your workforce is happy, you're better placed to deliver outstanding compassionate care to your patients.
The best bit is my team. I'm really fortunate to have worked with our team, and we have a common goal and common purpose. I think that's what sort of led us to having been able to deal with the waiting list initiative. I would rather work in Northamptonshire than work in the nearby trust, but I think in itself is an indication that I enjoy working within the trust, and I feel that I'm making contribution, but at the same time I'm getting recognition for what I do. I get very positive feedback from my patients, and it's really rewarding when you see that you are making a little difference to people's lives. So I will say, come, join our team, and you will have a great time.
There is a learning culture. It's not only the cultural aspects of diversity in the population cohort, but there's an element of learning culture which I find very, very helpful. Even if we make any mistakes, which we do at times, we acknowledge it and learn from it. And even if people are thankful for whatever service they have, we acknowledge it with the same breath. So there is an element of culture of learning which helps the trust to get better and better. And maybe one day from outstanding we can be exceptional, I don't know.
I feel very well supported within the trust. I'm encouraged to access training. I feel that the vision for the trust is one that I personally aspire to. I feel that patient care is always at the centre, and I feel that anybody coming to work in the trust will be proud of the organisation that they work for.
What I enjoy most is the open door policy that most of my colleagues, operate on. I think I find that very, very, helpful. And sincerely, I think I find it humbling as well because, you would expect maybe someone at the level of a medical director to, be up there, you know, not relate with people maybe just coming in, or people he or she feels they're not at par. But I think the reverse, I mean, that's not what we experienced. They've, you know, you can easily communicate with them. You can pick up your phones and call. I can call my clinical director, you understand? I mean, many times we have informal discussions, especially regarding patient care, and they're very approachable. So I think I like that.
Just to add, I guess, is one thing that, you know, I spoke to, when we came in here, and I spoke to my friends who were already here, you know, as clinical fellows, and I told them the welcome that we had within the trust. And they asked me a question, have you come to the UK or some other country? Because we didn't have this, you know, this thing here. So that was something, you know, because I didn't know how it went for them. But then I understood how good it was, you know, how supportive they were. And, you know, that's one of the examples to kind of elaborate how supportive the trust was.
I've got colleagues too who are showing interest, even people that are working for another trust in the UK who wouldn't mind coming over, you know. So I think a lot of people are really keenly interested in joining the trust.
I've already encouraged 2 of my colleagues from back home who already joined the trust. So I guess that speaks for itself.
Well, I would say it's a brilliant trust. It's for all the trainees or for anyone who would like to work in NHFT. I can just say that you will enjoy your journey here. You will always feel supported. You will always feel empowered to do more. I can't advocate for it more than that. I can just say if you would like to start your journey in psychiatry, in mental health, NHFT is the best trust you can work in.
If you're looking for a trust with plenty of variety, with excellent opportunities for research and development, with support to progress and to develop, working within an environment where culture encourages you to be a leader, NHFT is the place for you.